Hey guys, just going to take a moment to do a quick refresher on our ISTATs. We've had an increase in errors related to our ISTAT, so we just want to make sure that everyone is following the proper procedure and the correct steps. So many of you already know this part of the ISTAT test. You're obviously going to power on. We're going to select 2 because we want to run an ISTAT, and it's going to ask us to go through the prompts to scan our badge. And then we need to scan our patient's sample. It's really important that you scan rather than type in, because that is one way we increase errors, is by typing in. So make sure you're scanning their sticker instead of typing. And then once we've done our badge, our patient, scan your cartridge, and then we're going to continue to follow the prompts. This is where some of the errors are occurring. So with our Chem8, you've got your Chem8 cartridge. Just going to point out a couple things. Obviously your fill well is here. You want to make sure that you are filling it to the appropriate height or amount. So we are seeing an increase in underfilled and overfilled samples, and so it's really important that you're getting the appropriate amount of sample filled in there. Make sure you're not getting air in the chamber, because that will cause an error to happen. So once you fill these, whether it's going to be the Chem8 or the lactic, and I know we are still doing some of the ISTAT troponins, once you've applied your sample, just let it sit for a few seconds before you close the clip. That allows that to just settle, which is really important for the success of for a result. The next step obviously is we're going to take our cartridge and we want to gently insert it into the machine. There is a magnetic property when we are inserting. You do not need to be rough and getting this in there. I know we get in a hurry and that sometimes we push hard on those, but just give it a gentle push. That magnet takes the rest in there, and then it starts running the test. If you have any questions, be sure and let us know on the sampling and filling of the application. The other thing that's really important is once the test has started running, do not move the ISTAT monitor, because movement can affect the results. It can cause an error to occur. So you want to leave that ISTAT machine laying flat and not move it until the test is complete. If you have any questions, please let us know.